Hello, today I would like to introduce the OneMS kit for digital guided surgery in narrow mandibular ridges. As the name suggests, the OneMS kit is a guided surgery kit developed by applying the OneGuide system to the existing MS kit. It can be used for placement of MS implants as well as KS3 and TS3 Ø3.0 implants. Let's start with the first benefit. The OneMS kit enables precise implant placement in the mandibular anterior region. Precise drilling is possible even in narrow ridges of 5 mm or less. When placing implants without a guide in narrow mandibular ridges, the drill may slip during drilling because the ridge is extremely thin and the working space is limited. In mandibular anterior cases, drill slippage may increase the risk of bone perforation toward the lingual cortical bone or labial side. In addition, because the interdental space is very narrow, there is also a risk of damaging adjacent tooth roots during drilling. For these reasons, guided surgery using the OneMS kit is highly recommended for narrow mandibular ridge cases. As shown on the right side, the implant position and angulation can be planned more accurately even in narrow ridges, allowing clinicians to place the implant precisely as planned using the guide. The second benefit is accurate drilling without slippage in immediate placement cases. In mandibular anterior regions, immediate placement is often performed after extraction. However, even when using a guide, the pointed drill may slip along the inclined extraction socket surface during drilling. In these situations, we recommend using the OneMS Path Drill first. The flat design at the tip helps prevent slippage and maintains the intended drilling path. Because the path drill establishes the drilling path according to the planned implant position and angulation, clinicians can perform subsequent drilling more accurately and place the implant as planned. The third benefit is accurate drilling without slippage in narrow ridges. Similar to extraction socket cases, even with guided surgery, drilling paths may deviate slightly in extremely narrow ridges due to drill slippage. Therefore, instead of starting directly with a pointed drill, we recommend using the flattening drill first to create a stable drilling platform. The flattening drill flattens the ridge surface to reduce drill slippage and enable straighter drilling. The fourth benefit is compatibility with KS3 and TS3 Ø3.0 implant placement. In addition to the one-body MS implant, the OneMS kit also supports placement of two-piece Ø3.0 implants such as KS3 and TS3. Therefore, in cases where prosthetic path correction is difficult with MS implants, clinicians can utilize two-piece implants together with transfer abutments or angled abutments. This allows improved prosthetic path correction and easier prosthetic maintenance using ER-type prosthetic restorations. Next, let's take a look at the OneMS kit components. Because the kit supports both TS per kilo Siemens Ø3.0 implants and MS implants, separate implant drivers and no-mount drivers are included for each system. In addition, the OneMS Path Drill and MS denture driver tool are sold separately and not included as standard components. Now let's review the surgical workflow. One important point during drilling is that the OneMS drill system does not include a separate initial drill. Instead, the 8.5 mm long drill for each diameter functions as the initial drill. Therefore, clinicians should always use 8.5 mm long drill first before proceeding to final drilling. For example, when using a O2.3 drill after AO1.8 drill, clinicians should not proceed directly to final drilling. Instead, 8.5 mm drill should be used first, followed by final drilling. Even when using only a single diameter, clinicians should first use the 8.5 mm long drill and then proceed according to the implant length drilling sequence. Finally, during implant placement, the MS narrow ridge type allows both drilling and implant placement while the guide remains in place. However, for the MS denture type, the guide must be removed before implant placement. This is because the MS denture driver tool is too large to fit inside the OneMS guide hole. This concludes the introduction to the OneMS kit for overcoming the limitations of narrow mandibular ridges in the mandibular anterior region. Thank you for your attention.